Hi everyone, I'm Kathleen Jade M. Galang, and for today's video is all about basic life support, or also known as BLS. These are life-saving skills you can use in an emergency situation when someone is not breathing or their heart has stopped. Every second counts, so knowing BLS can make a difference. And for our learning objectives, first, nurses will recognize the signs and symptoms of sudden cardiac arrest. Second, nurses will activate the emergency response system by calling 998 or the local emergency number immediately and providing clear and concise information about the situation. Third, nurses will perform high-quality chest compression on adult patient in cardiac arrest. Fourth, nurses will deliver rescue breaths using a face shield or other appropriate barrier device. And lastly, nurses will demonstrate the ability to use the AED safely and effectively following the device's visual and audio prompts. Imagine you're out and about and you witness someone collapse. They're not breathing and have no pulse. What will you do? Don't panic. BLS can help. CPR or cardiopulmonary resuscitation is an emergency life-saving procedure performed when the heart stops beating. An emergency procedure that combines chest compression, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. So why CPR is important? Keeping the blood flow active, even partially, extends the opportunity for a successful resuscitation.
For general public or bystanders, provide high-quality CPR by push hard and fast. Allow complete chest recall. Minimize interruptions. Give effective breaths. Do not overventilate the patient. When to start CPR if the person is unconscious, not breathing, and does not have pulse?
When to start CPR? First, if the patient is unconscious, the person does not respond when you try to talk to them or shake them gently. No breathing normally. They are not breathing at all, or their breathing is shallow or gasping. You can look for chest rise and fall and listen for breaths close to their mouth or feel for breaths on your cheek. No pulse. You cannot feel a pulse? Remember, check for a pulse for no more than 10 seconds. When to stop CPR? First, if the scene is not safe. Turn over for professional provider when the operator is exhausted, when the physician resumes responsibility, and if there is spontaneous signs of life. For the location of pulse for adult, infant, and child, for adult, check the carotid pulse. For infant, brachial pulse, and for child, check the carotid or the femoral artery. In sequence of BLS from airway breathing circulation to CAB. In CAB, chest compressions will be initiated sooner and ventilation only minimally delayed until completion of the first cycle of chest compressions. Remember, 30 compressions should be accomplished in approximately 18 seconds. What are the other things that we need to remember? Compression rate. Compress at a rate of 100 to 120 per minute with a depth of at least 2 to 2.4 inches or 5 to 6 centimeter for adult, at least 1/3 the depth of the chest, less than 2 inches for small children, and approximately 2 inches for larger children, while for infant, approximately 1.5 inches or 4 centimeter. Check the patient for pulse for 5 to 10 seconds. Do not check for more than 10 seconds. And for airway, in the event of an unwitnessed collapse, drowning, or trauma, use the jaw thrust maneuver. While in the event of a witnessed collapse with no reason To assume a spinal cord injury, use head tilt chin lift maneuver. What are the 5 cycles of CPR? This refers to how many cycles of CPR you should perform in 2 minutes. 30 compressions and 2 rescue breaths are 1 cycle. For CPR to be effective, rescuers should perform 5 cycles in 2 minutes. Additionally, it's recommended that rescuers swap after 2 minutes and 5 cycles to prevent exhaustion and maintain effective compression. Now, here's the flow of basic life support for a single rescuer encountering an adult who is unconscious, no pulse, and not breathing. First, ensure safety. Your goal is to affirm your safety and the safety of your team, as well as the patient and the bystanders. Next is response and assessment. Check the level of consciousness. To check for responsiveness, gently tap the person's shoulder and shout loudly, "Are you okay?" Then check for circulation and breathing. Check for carotid pulse for not more than 10 seconds. And check for respiration. Next, call EMS. If there's no response, activate the emergency medical services immediately. Call 998 and get AED. Send someone for help or to call your emergency number and to get an AED. Next, begin CPR. If the person is not breathing, begin chest compressions immediately. Position yourself at the center of the chest on the breastbone. Push hard and fast at a rate of 100 to 120 compressions per minute. Push down at least 2 inches with each compression. Allow the chest to fully recoil between compressions. Give rescue breaths. If you are trained in giving rescue breaths, deliver 2 breaths after every 30 compressions. Let's go now to AED machine. The automated external defibrillator is an electronic medical device. An AED can check a person's heart rhythm. It can recognize a rhythm that requires a shock. And it can advise the rescuer when a shock is needed. The AED uses a voice prompts, lights, and text messages to tell the rescuer the steps to take. What are the precautions in using an AED? Do not use alcohol to wipe the patient's chest. Do not defibrillate someone when around flammable materials. Do not use an AED on a person with water. If the person has implanted device or pacemaker, place the pads as close to the correct position as possible without being directly over the device. With medication patches, remove the patch, wipe the skin dry, and apply AED pads. It is safe to use an AED if the person is lying in snow. If the person is under 8 years of age, use child pads if available. If not available, you may use the adult pads. One pad is placed on the chest and the other pad is placed on the back. Pad should sandwich the heart when placed appropriately. If the patient is 8 years of age and older, use adult pads. Do not use child pads. They will likely give a shock dose that is too low. Let's watch a video demonstrating basic life support with an AED machine.
Hey, you activate emergency response system and get ready. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Apply pads to patient's bare chest. Plug-in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient.
I'm clear. Everybody clear?
Deliver shock now. Press the orange button. Shock delivered. Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient.
I am clear. I am clear. Everybody
Deliver
clear?
shock now. Shock delivered. Begin CPR. Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange. Shock delivered. Begin CPR.